The risk of eye infection increase during the monsoon season. Moisture and dirt can lead to infections such as redness, irritation, itching, and allergic reactions. Ophthalmologist Dr. Rohan Mehra from Chamari Institute informed about symptoms and remedies for these infections. Have a look at this report.
Very good evening. I am Dr. Rohan Mehra, Phaco and Refractive Surgeon at CKI Institute in Saharanpur. We know that the monsoon is round the corner now, and in monsoon, in the rainy season, it not just only brings joy to the children, but it also brings a lot of infectious diseases, especially in the eye. We are seeing every single day there is rampantly prevalent bacterial as well as viral infection that is there, that is causing severe red eye, itching, irritation as well as blurring in vision. So what can we do to prevent it? First of all, what happens is that whenever we feel any itching in the eye, our first reaction is that we should always splash water in the eye, which is incorrect. It should never be done. You should never ever splash water into the open eye, because all that does is it dilutes the natural defense that is there present in our eye. So never ever splash water on open eyes. That is the first thing to do. Second is, do not self-medicate. What we do is we go to a medical store, you get a drop and you use that drop. Now what happens is, more often than not, that drop is a steroid drop. That steroid drop only harbors infection and increases the bacterial load rather than reducing the bacterial load. So visit an eye doctor, make sure that the pressures of your eye are fine. There are so many cases and instances where people have taken over-the-counter medication and they have lost their eyesight completely because they were responders to steroid and they got a steroid from the medical shop. So don't ever do that. You please come to the ophthalmologist and then get your eyes examined and take the medication. Second thing very important is, whenever there is eye flu to one family member, there is a high chance that it gets spread to other family members as well. Now, how do you prevent that? Simply, you have to have a separate pillow cover, separate bed sheet and separate washing of clothes of the person who is suffering from eye flu. They should not be making contact with other people, including handshake, because it is extremely communicable. And now, very soon, schools are also reopening. So once holidays finish and schools reopen, it becomes very deadly for the children, because maybe two people in the classroom have conjunctivitis and it spreads to everybody in the classroom. So one has to be very careful about hand hygiene and hand cleanliness, and don't ever rub your eyes during this season. The other very important factor is, avoid going into swimming pools. Now, once any person infected with conjunctivitis enters the swimming pool, anybody who will enter it for the next 8 hours will get conjunctivitis. So avoid going for swimming lessons for the next about month and a half till the monsoon subsides, because it can cause sporadic and very fulminant conjunctivitis.